Hello everyone! Regarding information, we are back on the sidelines of your activities with us. I'm Nadia Ramaulia.
I'm Nabila Zedetulwazan.
I'm Mr. Sada.
I'm Suti Rahmawati.
And I'm Sabina Sofia Sama, which will provide the latest news regarding the core protein in Indonesia. Enjoy our video. Check it out!
World News, Documentary, Live Report, Disease, Protein Deficiency.
One of the nutritional problems in Indonesia is a lack of protein energy, commonly called PEM. PEM is caused by deficiency of macronutrients or deficiency of micronutrients. However, several regions in Indonesia still have a high prevalence of PEM, greater than 30%. So, here we'll discuss. Number 1. What are the factors causing PEM in Indonesia? At the macro level, the magnitude and extent of the KEP problem is closely related to the overall economic situation. Household members from economically vulnerable groups provide an overview of food availability and the scope of PEM biological risk. At the macro level, the level of health, infectious diseases, which also describes the environmental situation, are determining factors for KEP. The degree of health is influenced by availability of health services, clean water, sanitation, and other social services, whether or not health services are sufficient, especially for the poor, depends on the government budget provided for health services and other social services. In difficult economic conditions, the government tends to make savings which often have an impact on budget provisions for the social sector. Household income is one of the determining factors for family consumption. Apart from that, consumption for the family is also influenced by food prices and non-food prices.
What is the impact of PEM, mortality rates, morbidity rates, and life expectancy? There are many negative impacts caused by KEP, including reduced quality of life, impaired growth, impaired mental development of children, and is one of the causes of high mortality rates year 2000. Children suffering from PEM are the opposite, treating it immediately has a very high price and can end in their child state. This will lead to an increase in infant mortality and is a false indicator of health status. A deficiency of one of the nutrients needed in food is called malnutrition, which means an incorrect or inadequate diet. This causes deficiency, which can cause several diseases. Protein deficiency disease mostly affects children aged 1 until 5 years. Their lack of protein, fat, carbohydrates is called protein energy malnutrition. This causes two types of disease, kwashiorkor and marasmus. If a child gets poor protein intake, a disease called kwashiorkor will arise. This disease inhibits the child's growth and development.
Said that, what is kwashiorkor? Kwashiorkor is a form of malnutrition, hunger edema caused by protein, also known as endomatous malnutrition because the dominant symptom is edema or accumulation of fluid in the body, especially in the ankle area, stomach, and throughout the body. If anyone is suspected of having kwashiorkor, next blood tests and urine tests are needed. Other tests may be performed on blood and urine to measure change of poor nutrition and lack of protein. These tests can look for muscle damage and assess kidney function. The inspection in question includes 1. Arterial blood gases. 2. Blood urea, nitrogen. 3. Creatinine levels. 4. Potassium levels. To see hyperkalemia or hypokalemia. 5. Urinalysis. And 6. Complex blood count.
And then, what is marasmus? Marasmus is a condition characterized by a lack of calories and fluid in the body and depletion of fat reserve. Marasmus is a common health problem in developing countries and can be experienced by both children and adults. What are the characteristics of the marasmus in children? The main symptom of children experiencing marasmus is drastic weight loss. Marasmus is also synonymous with loss of fat and muscle mass, so that a person can look very thin. In addition, marasmus often begins with feelings of hunger and several other symptoms of malnutrition, including fatigue, decreased body temperature, chronic diarrhea, respiratory tract infections, emotional disorder in children are not showing emotional expression, irritability, lethargy, slow breathing, shaking hands, dry and rough skin, and baldness. What causes marasmus? 1. Less calorie intake. 2. Eating disorders. 3. Health status. 4. Congenital conditions. Additionally, the following are factors that increase the risk of marasmus. 1. The mother breast milk production is not enough because her body is malnourished. Number 2. Viral bacteria and parasitic infection. Number 3. Living in an area with high levels of hunger. Number 4. Living in an area with high disease rates. Number 5. Insufficient medical care.
Okay, next we will discuss what specific protein deficiency diseases are. There are three main conditions that result from a lack of specific protein in the body. First, protein C deficiency. People who experience this condition are mostly caused by hereditary diseases that affect the body's natural anticoagulant production. This causes abnormal bottling thrombocytes, especially in the veins. Second, protein deficiency also affect the production of natural anticoagulants. However, the causes can be genetic or acquired through vitamin K deficiency. Alpha 1 antitrypsin deficiency, a type of protein deficiency syndrome, causes difficult breathing, wheezing, impaired vision, and weakness. Lack of mitochondrial functional protein causes low blood sugar, weak heart, and liver problems. Mostly shrinkage and weakness, and the baby will have difficult breastfeeding. Prevention of protein energy malnutrition. Protein energy malnutrition can be prevented by adopting a healthy, balanced diet that includes carbohydrate sources such as rice or potato. Protein and fat sources such as red meat, fish, eggs, or poultry. Sources of mineral and vitamin such as fruits and vegetables, as well as milk and processed products such as cheese or yogurt. Apart from consuming healthy food, don't forget to drink water as needed. Then, there are the impact caused by PEM problems such as decreasing physical and intellectual quality and reducing body resistance, which result in the risk of illness and death. The consequence of a decrease in the body's immune system can cause failure in the function of the digestive organ, liver, endocrine glands, cardiovascular system, and also the kidneys.
Conclusion: the factor causing PEM in Indonesia involve aspects of the economy, health, and social services. So the effort to overcome nutritional problems in Indonesia can be separated from effort to eradicate poverty. If the income aspect responds well to change in food consumption, it will be in accordance with need and adequacy. While the impact of KEP on morbidity, mortality, and life expectancy involve an increase in quality of life, impaired growth, and can cause serious illness such as kwashiorkor and marasmus. This condition also has a negative impact on the body's organ and reduce the body's resistance, increase the risk of illness, and has the potential to cause death. Things that can be done to prevent serious illness are by adopting a healthy lifestyle and consuming nutritious food.